Chapter 6, June 6, 1917. May was arranging flowers in a vase on her desk in the office entry area. She had picked these early June blooms from her beloved flower garden that morning. The fragrance of the bell-shaped white peach and orange hyacinths was an unmistakable reminder of spring turned to summer. Red and pale yellow tulips, purple and white bicolored irises, and yellow daffodils added to the explosion of colors in the vase. The fragrance and the colors made Dr. Harvey think of Marie and how she loved flowers. He also thought of reports from Europe about the endless battle there, the numbers of flowers loved ones would be placing on graves once the bloodletting subsided, the young men who would not live to be fathers. "How many railroad workers are scheduled today?" he asked May, knowing a crew change had occurred and the members of one crew would have a layover in town. For some workers, a layover in town where the company had contracted with a physician was the only opportunity for medical care. Thus, visits for a work-related injury or condition were sometimes extended for evaluation of additional medical issues. Dr. Harvey asked, "Who else is on the schedule?" 3 railroad workers will be coming in this morning, and Frances Olson, the county school superintendent, wants to talk with you at noon, replied May. "I'll be glad to talk with her. Interesting she is coming here," remarked Dr. Harvey. The office door opened and a portly man who appeared to be at least 50 years old entered. He removed his wool cap, but when he slipped off his hip-length jacket, he leaned slightly to his left, as if to avoid moving his right side. May greeted him and motioned towards Dr. Harvey. "Please come right in," said Dr. Harvey. After both men were in the examination room, he continued, "What brings you for medical attention today?" The man replied with a British accent, "I keep having pains right here." He pointed to his right lower abdomen and groin area. "When did you begin feeling this pain?" asked Dr. Harvey. "About 3 weeks ago in Illinois," he said. "I supervise a crew of linemen for the Milwaukee Road. We were repairing track outside Rockford. I started to pick up a rail, and darned if I didn't trip and fall beside the track. I felt the pain when I stood up." "Did you seek medical attention then?" asked Dr. Harvey. "I saw a doctor the next day. He told me I had a hernia and might need surgery to fix it," replied the railroad worker. "But I asked that doctor if there was some other way to fix this. He said I could try using a truss, but I might need surgery eventually to control the pain. So I've been wearing a truss. The pain keeps coming and going." Dr. Harvey asked several questions about the pain in order to learn it was right-sided, intermittent, and associated with movement. He asked the railroad worker to drop his drawers. The worker's truss was white, although it would be much whiter if washed, and consisted of a waistband and straps extending from front to back on either side of the worker's scrotum. He told the worker he needed to examine his lower abdomen. He saw a mass protruding from the right inguinal area, and he palpated the mass and asked the worker to cough. The bulge protruded further. The worker said, "I feel the pain now, Doc." The remainder of the physical exam was unremarkable. He asked the worker to reposition the truss and get dressed. He said, "You need to have surgery before this gets worse. Right now, the hernia bulge is just part of the sac from the abdominal cavity. It's called an omentum. But if part of the intestine drops into the hernia area, it could get stuck. We call that incarcerated. If the intestine lost its blood supply, emergency surgery would be necessary. It would be better to schedule surgery now rather than to chance an emergency." "Can you do the surgery here?" asked the worker. "If there was an emergency, I could reduce the hernia here," he replied. "However, I recommend you see a surgeon, and there's a good one in Miles City. If you agree, I'll call him to schedule an appointment. I think you should not return to work until you have the surgical repair." "Well, I guess I'd better have the surgery," said the worker. "Please go ahead and contact the surgeon to see when I could get this done." "Could you get to Miles City sometime this week?" asked Dr. Harvey. The man indicated that he could take the train any day. "I will call and schedule a time. I will also prepare a letter you can use to arrange some work time off for the surgery and recovery," he said. "If you come back later this morning, my assistant May will have the letter and more information about seeing the surgeon." He walked with the worker into the office entry area. He told May this worker would return for more information later and asked her to prepare a medical leave letter for him to complete and sign. Before seeing the next patient, he called the Miles City surgeon's office and left a message with the assistant there. He requested a return call to confirm a time when this patient could be seen and when inguinal hernia repair could be done. May said, "The next railroad worker is here. He does not look well." Dr. Harvey replied, "Please ask him to come in." The young man was about 5 feet 10 inches in height and very thin. Dr. Harvey imagined this man might have trouble staying upright if he were outside during a stiff Montana windstorm. Like the previous worker, this man removed a wool cap and a hip-length jacket. But under the jacket, he wore a woolen pullover sweater. Dr. Harvey thought it unusual to wear such a heavy sweater on a sunny June day with only a mild wind blowing. "Please have a seat," said Dr. Harvey. "What brings you in for medical attention today?" The young man sat. His eyes were sunken and his thoughts seemed to be elsewhere. "I'm afraid I cannot work any longer. I have no energy," he said. Dr. Harvey guessed this man was chronically ill and might have received some medical attention previously. He responded, "Tell me a little more about yourself. Do you see another physician too?" "Oh, yes," said the man. "I have a doctor back home in Rockford. About 6 or 8 months ago, he told me I have diabetes. I have been trying to follow his advice, but I just keep feeling weaker and weaker. I want to know if there's anything I can do to get over this." Dr. Harvey replied, "I'll double-check to confirm the diagnosis, but if you have diabetes, the treatment options are limited. There is no known cure. What treatments are you using now?" The young man looked at him for a moment and then said, "I'm starving. That's what the doctor advised me to do, but it's hard to eat so little when I am hungry and I have no energy for work. I still pee frequently and I'm always thirsty." Dr. Harvey was aware of this type of treatment for diabetes. He had learned about it during his training at Northwestern. American doctors in Boston were leading advocates of severe calorie-restricted diets. They advised repeated fasting and prolonged undernourishment. They knew this was not a cure, but wanted to relieve symptoms caused by too much sugar glucose in the blood. The goal of this treatment was to extend a patient's life. However, the extent to which a starvation diet achieved this goal was not clear to Dr. Harvey. He leaned towards an alternate treatment he had also learned at Northwestern. He asked, "Before you began limiting your food intake so strictly, were there times you would lose consciousness?" "I did, more than once," replied the man. "That's when my doctor told me to fast and expect to lose much of my weight." Dr. Harvey asked the young man to urinate into a container. The urine smelled sweet like syrup. He tested it and found a very high level of sugar. Then he reviewed information about diabetes with the patient. "I'm sure you know diabetes leads to too much sugar building up in your blood. This causes the thirst you have. Your kidneys rid your body of some of the sugar, and this causes your frequent urination. When the blood sugar level gets very high, it's called hyperglycemia and can cause a loss of consciousness. This can be life-threatening. The severely restricted diet is one way to try to avoid this crisis." He paused briefly and continued, "There is an alternate approach for diet treatments for diabetes. Instead of severely restricting the entire diet, the alternate approach restricts foods containing carbohydrates. The body converts carbohydrates to sugars. This alternate approach emphasizes meats in the diets, so it is sometimes called an animal diet. With this diet, you would gain some weight back. You might not need to wear such a heavy sweater during the summer, although you would probably still have frequent urination and bouts of thirst. This is not a cure, just an alternate approach." The young man seemed more animated when he replied, possibly ascribing more hope to the alternate approach than Dr. Harvey had intended. He said, "I would like to try the alternate approach. If I could gain some weight, I could keep working." Dr. Harvey replied cautiously, "I can't promise the animal diet would increase your energy level, although it is likely you would gain some weight. I will give you information about this diet so you can begin trying it. I encourage you to discuss this with your doctor when you get back to Rockford, too." Dr. Harvey then gave his patient written information describing the low-carbohydrate diet many physicians were recommending. He did not tell the young man to return to work. Instead, he advised him to wait until he gained some weight. At that time, a decision regarding readiness and safety for work could be considered. He was not optimistic about this patient working again in the near future, but saw no reason to share his doubts today. The polite young man said, "Thank you, doctor. I will try this diet." He donned his jacket, carried his cap, and also said thank you to May as he departed. The third railroad worker to visit was the lineman with gonorrhea Dr. Harvey had seen in April. Dr. Harvey asked, "Have you been able to continue treating yourself with the urethral infusions each day. The recommended duration for this treatment is 6 weeks, and it has been 5 since your treatment began. The lineman replied, Well, Doc, I kept it up until this week, but it's a shitload of trouble to keep doing this. Are you having pain or burning when you urinate? Has your urine been cloudy? Or have you seen blood in your urine? Asked Dr. Harvey. No, said the lineman. I'm back to normal as close as I can tell, and I sure don't like that treatment. Dr. Harvey thought for a minute. He suspected this man would not continue the urethral infusions even if recommended to do so. He also knew that the regimen had not been convincingly documented to be effective. He said, Since your symptoms have cleared, it is reasonable to discontinue the treatment after 5 weeks. Also, your blood test for syphilis was negative, so no additional therapy is needed for that, at least at this time. The lineman, clearly relieved by learning the treatment had ended, responded, I appreciate your help. Guess I should be more careful about the houses I choose. Dr. Harvey knew this man would continue visiting bordellos in the towns where he worked, so he advised, If you want to lessen the chance of more bouts with clap or with syphilis, you should wear protection regardless of the house you choose. This will help protect the women you do business with, too. They are supporting themselves, and often others, so protection makes sense all around. The lineman frowned, but said nothing more. He nodded in reluctant recognition as he walked out of the examination room. Dr. Harvey spent a few minutes writing notes in his office records about patients he had seen so far during the morning, and then saw more patients seeking help for a variety of ailments. The last of these left a little before noon. May knocked lightly on the examination room door. Dr. Harvey said, Come in. Superintendent Olson is here now, she said. Please tell her I'll be ready in just a few minutes, he said, really realizing how unusual it was for a superintendent to visit him at his office. Dr. Harvey had come to Forsyth to support a medical practice while a local physician served in the Army Medical Corps. From the moment the United States entered the war in Europe, the duration of Dr. Harvey's agreement to practice here was no more defined than was the duration of the local physician's commitment to the Army. He had been too busy in his medical practice to think about the ambiguity of this. He appreciated the opportunity he had. Before enlisting in the Army Medical Corps, the local physician had also served as the county health officer, a position Montana state law required commissioners in each county to designate. Dr. Harvey had agreed to fill this role too. Perhaps a public health issue had prompted today's visit. Rather than guess further, he opened the door of the examination room. Hello, Francis. Please come in. I'm looking forward to talking with you, he greeted. He turned to May and said, Please enjoy a lunch break. I'll see you this afternoon when the next patient is scheduled. While Francis Olson walked into the examination room and sat in a chair near Dr. Harvey's desk, May stepped closer to him and said in a low voice, Mr. Mueller called a few minutes ago to ask if you would see his niece this afternoon. I told him you would. He plans to bring her at 4:30. That is the last scheduled appointment today. He said, Thanks. Enjoy your lunch. Dr. Harvey took a seat at his desk in the examination room and said, It is a special privilege to have you here. Would you like some water or coffee? She shook her head to indicate no. She was a short, neatly dressed woman whose posture and intense gaze gave her an aura of authority. She began, As you know, some students, 3 I believe, were away from school with smallpox this spring. Other students exposed to those students continued to come to school, even though they had not had smallpox vaccination. I just returned from a school superintendent's meeting in Helena. Dr. Cogswell of the State Board of Health talked with us there. He said smallpox cases in school-aged children had been reported from several areas in the state. He urged us to be sure all students had been vaccinated against smallpox. The State Board of Health plans to establish a rule to require smallpox vaccination for students and to exclude those who have not been vaccinated. I learned from my colleagues at the meeting that some school districts have plans to enforce such a requirement. Dr. Harvey said, I haven't learned all I need to know yet as the county health officer. Has a requirement like this been considered already for Rosebud County schools? Francis replied, No, not yet. This is what I want to discuss with you. He thought for a moment about the smallpox cases he had seen since he arrived in this county. The cases included a 9-year-old girl, her younger brother, and a neighbor girl, 8 years old, as well as brothers 9 and 12 years old from a ranch southeast of town. He had made diagnoses for each of these unvaccinated children and told each family to keep ill children home and isolated from others for 14 days after onset of illness. The families had agreed to do this, but keeping sick children isolated was not the biggest challenge for controlling the spread of this disease. The more difficult issue was trying to ensure that unvaccinated persons exposed to smallpox case got vaccinated, or if they remained unvaccinated, that they stay home. So if they became ill, they would not expose even more people. He knew some parents were opposed to vaccination, some of those opposed so vehemently against any government requirement, and some considered vaccination unnatural or against their religious beliefs. In medical school, he had learned that some states had required smallpox vaccination for entry to public schools. He felt this requirement should be in place in Rosebud County, too. He had not fully realized unvaccinated students exposed to smallpox were remaining in school. This would certainly increase the spread of the disease. Of course I support the advice you received from Dr. Cogswell, he said. It would be best to identify the unvaccinated students immediately and exclude them from school until they are vaccinated, or at least until 14 days had passed since the last exposure to smallpox. This would be a quarantine measure. I will do whatever I can to help establish a vaccination and quarantine policy. Francis said, school is out for the summer, so there is time to work on this issue before school convenes in the autumn. Dr. Harvey continued, I need to review the quarantine policy not only for schools but also for other places public gatherings occur. For smallpox, there is a vaccine to prevent the disease. However, for other communicable diseases, including whooping cough and scarlet fever, there is no vaccine. Isolation of parents with these diseases, along with quarantine of some persons exposed to these patients, is an important step we can take to prevent more disease. Perhaps we could prepare a policy recommendation and discuss it with the county commissioners before school reconvenes next autumn. She replied, that would be an excellent approach. Dr. Harvey said, yes, I'll prepare some text for quarantine and vaccination policies and get it to you within a few days. Thank you for coming today. May entered the office as Frances Olson was leaving. She held the door open and said, very nice to see you. Nice to see you as well, Frances replied. May looked at Dr. Harvey and asked curiously, was there enough time for your meeting? He replied, knowing May would like to learn the reason for the meeting. We discussed some ideas related to the quarantine and control of communicable diseases. We need to discuss some policy issues with the county commissioners. Someday medicine will know more about the causes and way to control these diseases. But now we use control measures not so different from those used generations ago. At least we don't bleed patients these days. Well, most doctors don't. May seemed satisfied with that information. While removing her coat, she said, your next patient should be here soon. Don't forget Mr. Mueller is bringing his niece this afternoon, too. Then she added, did you get any lunch? Should I get something for you? He said, I can do without lunch today, but thank you for asking. He walked back into the examination room, thinking more about vaccination and quarantine policies than about lunch. The symptoms reported by patients during the afternoon were those that he had become accustomed to assessing. One man told of coughing blood, weight loss, fever, and night sweats. Dr. Harvey suspected tuberculosis and collected sputum for laboratory examination. A woman reported that she had trouble breathing and swollen ankles. He diagnosed heart failure and talked to her about the foxglove flower and a drug called digitalis. Other patients had a variety of pain, sprains, and a drain problem, as one man described his difficulty urinating. All in all, it was a typical afternoon in a rural doctor's medical practice. At 4:30, he heard May talking with a man whose strong German accent and use of German words and otherwise English sentences made it easy for him to guess Herman Mueller had arrived. He stepped from the examination room into the entry room and said, Guten Tag, Herr Mueller. Guten Tag, came a reply. Ich habe, I brought my niece to see you. She is not nicht eating, nicht sleeping. He began to list problems he had perceived. Dr. Harvey interrupted as politely as he could, not wanting the young woman to feel uncomfortable while her uncle recited his reasons for her visit today. He said, I have not had the pleasure to meet your niece. Herman had stopped talking, but quickly resumed. This is Gerd, mein nicht. She has lived with us vier Jahr. Mein Schwester sent her here in May 1914, after mein Schwager died in 1913. We planned for mein Schweitzer and her 3 Kinder to come live with us. She sent Gerd first, but the terrible war began. She and the other children have not been able to come. While while he listened, Dr. Harvey was observing the young woman, who appeared very meek and shy, and whose gaze was downward. He interrupted again to say, "Hello, Gerd." He mentioned toward the examination room and continued, "Perhaps you would like to come into the room to talk." He then looked at Herman and asked, "Would you like some coffee or water?" He asked May, "Would you please get Mr. Mueller something to drink?" "Yes, may I get you some coffee?" May asked while Gerd stepped into the examination room and Dr. Harvey closed the door. "Please have a seat," he said while gesturing to a chair beside his desk. He remained struck by how quiet and shy she was. He asked, "Do you speak English? Sprechen Sie English?" "I speak some English, ja," she replied as she sat in the chair. He realized some help with German-English translation might be necessary in order to determine the reason for this visit. However, he had sensed the young girl was not comfortable when her uncle was telling her story for her. Thus he was inclined not to ask Herman to help and interpret her statements at this time. Instead, he decided to proceed. "How old are you?" he asked. "Ich bin 18 Jahre, 18 years old," she replied. "What is the reason you came today?" he asked. She looked puzzled by this question, but replied, "Mein uncle brought me." He rephrased the question, "Why do you need to see a physician? What problem are you having?" She again looked puzzled and said, "I do not need a physician. Mein uncle brought me here." He rethought his approach to this very shy, very attractive young woman. She had beautiful facial features, fair skin, a high forehead, small nose, high cheekbones, and wide-set eyes. When she established eye contact, he sensed sadness in her medium brown eyes. She sat very straight in the chair, her hands clasped together in her lap. He asked, "Is there anything you want to talk about? Is there something I might be able to help you with?" She no longer looked puzzled. She appeared to be thinking about what to say, or perhaps whether to say anything. After a long pause, she said, almost too softly for him to hear, "Mein uncle treats me well. I know he wants me to be happy. But I miss mein Mutter, mein Schweitzer. I miss mein Schweitzer und mein brother. I think of them always. I want to see them, but I know I cannot. They are in Deutschland. I do not receive letters from them and cannot send letters." Tears welled up in her eyes. She looked downward again. He reached across the desk to hand her a small towel. She took it and wiped tears from her face. He said, "You must be very lonely. It is terrible this war has separated you from your mother and your family in Germany." He paused before saying, "The war will not last forever." She said, "I hope not. Every day seems to last forever. Ich bin in burden for mein uncle. He has too much burden." Her voice trailed off. "The bank must be paid," she continued. "Die Nachbarn, the neighbors, no longer visit." Her voice trailed off again. "Tell me about the neighbors," he said. "When I first came, we had Abendessen with Nachbarn each Sonntag. It was fröhlich, joyful. I talked with other Mädchen. Now we never see them. When mein uncle comes to town, he is called a Kraut lover and a traitor. He is nicht in Verräter. He loves this country. We have no contact with Deutschland. I wish we could. I miss mein mother," she said softly. "Your uncle said you were not eating and not sleeping," he said. "I eat a little, but I'm not hungry. I do not schlafen when I go to bed, so I can get up and sit by the chair window until einschlafen," she replied. He felt confident she was depressed and opted not to take a more thorough medical history or conduct a physical examination at this time. He said, I would like to give you some medication to help you sleep and also set a time for another office visit. Then you could tell me more about yourself and if the medication helped." She did not reply, but the look on her face made him think she was willing to try some medication. He wrote a prescription for a tincture of opium and handed it to her. "Let's go see your uncle in May," he said. When they returned to the entry room, he said to Herman, "I think some medication will help Gerd sleep better. I have given her a prescription you can take to the pharmacy. She is to take a teaspoon of the liquid at night before going to bed." To May, he said, "Please schedule another office visit in 2 weeks. Looking at Gerd, he said, "Would that be acceptable to you?" Gerd nodded in agreement. May suggested a date to which Herman agreed. Then he and Gerd departed. "She seems like a very nice young lady," said May. "Rather quiet, but very nice." "Quiet and thoughtful," he replied. "Unless other patients are scheduled. You might as well go home. I'm ready for some supper, and I'll bet you are too. They said one more thing. The Miles City surgeon called. A time for surgery later this week has been set. I told the railroad crew boss. He said he'd be there. Dr. Harvey walked from the office to his room at the hotel. He took items from the ice box, sliced a bread loaf, and began eating. He thought about language to use in a vaccination and quarantine policy. The situation Herman Mueller and his family were experiencing, and Gerd's loneliness. The latter made him think of his own loneliness, how he missed Marie. He poured a glass of whiskey and sipped as he ate.